All right, ready?
Yeah, what you got for me?
All right, everybody. So this is our biological dentist, Dr. Wiley Green. We have got a lot of questions on biological dentistry, so we're just going to go through just nonchalantly and just kind of have a conversation of the questions. First question is, what inspired you to become a biological dentist?
Well, that was a patient. So his name's Wayne Cox. It's one of the first patients I had when I was teaching at dental school. And he came into my office. I worked at night in Brownsburg, and he had 3 bridges in his hand. And Wayne Cox said, another dentist made these 3 bridges. They've come out of my mouth 3 times. I want them done right. So I looked at him, looked at his mouth, fixed his teeth, put 3 new bridges in there, and 15 years later, he called me on the phone and he said, hey, Wiley, what's under those bridges you put in my mouth? In 1975. And I said, well, that had to be amalgam, Wayne. That's the only filling material we had in 1975. Why do you ask? He said, well, I was going to an MD who was an environmentalist doctor and told him he was heavy metal toxic and he was being chelated. And the chelation had kind of come down to a plateau and he couldn't get the rest of it out. So he wasn't being exposed anywhere else to mercury, and that's why he asked what was under the bridge.
Wow.
So 6 months later, he stopped by my office and he brought me this book that he wrote with his physician. So when you read this book, I'm the bad guy in the book. And I said, Wayne, where did you learn this? And he told me, we'll go to the IAOMT. I looked it up on the web. I found they were having a meeting in Georgia in a couple of months. So I signed up, went to that meeting, and I learned all about why silver, mercury, amalgam fillings are poisonous. And 1992, 93 is when I quit doing them.
Wow.
So that was the start to my journey towards being holistic. Another interesting sidelight about Wayne was ever since I knew him, he had atrial fibrillation. And he got all his mercury fillings out, so that helped his overall health. But when he pulled that root canal tooth he had, since long before he knew me, the atrial fibrillation was gone the next day.
Wow.
And that he'd suffered with that for 30 years.
Wow.
So there is a huge connection between the energy system in your mouth and your teeth and your body.
How would you explain the biggest difference between biological dentistry and conventional dentistry to someone who is new to the idea?
A biological dentist is interested in your whole body, your body health. So he's going to use materials that are compatible with your particular DNA and system.
Yeah.
So there are tests that you can take to determine which dental materials are compatible with you. So there's a Clifford test and the BioComp test. BioComp comes from these people. This is who we usually use. It's a blood test that you have drawn, and it'll come back with like 12,000 different dental materials, filling materials, metal, gold crowns, implant materials, everything but the anesthetics, unfortunately.
Yeah. So one person, whatever you're packing, teeth with may work for one, but not another, and that's where these are.
Not necessarily all of them, but the stuff we use in my office, well, we've been doing it for many years. So we've had dozens, 50, 100 people take the test.
Yeah.
So the only things I stock in the office, I stock 3 or 4 different kinds, dental material, and those are the ones that have been found to be safe with virtually everybody. So our etching materials, our bonding materials, safe with everybody. And today on everybody, if we haven't seen them before and if they choose not to do a biological test or anything, we use Vocal brand materials. So Admira Infusion is made by the Vocal brand. It does not have any BPA in it. And that seems to be the biggest problem with a lot of people. Now, if somebody comes with me with a lot of allergies, I do kind of twist their arm and ask them to get that blood test.
Yeah.
It's about $300. So, you know, if you're doing $3,000, like 10 fillings, it's worth getting the test.
Yeah.
If you only got 2 or 3 or 4, then just use the safest stuff that's worked for everybody else.
Right on. How can someone find a qualified biological dentist in their area?
Well, there are 3 biological or holistic dental groups. So there's the holisticdental.org, so that's a HDA. There's the IABDM, which is the International Academy of Biological Medicine, Dentistry and Medicine. So that's IABDM.org, and there's the IAOMT.org. So either one of those, call them up, talk to them, look on the website. The IAOMT has a nice website with all of their dentist members listed, and it will describe how many meetings that dentist went to, and if the dentist did any extra work. So there are levels. You can be an affiliated dentist. A smart dentist means that you bought the equipment, like the suction, like the electrostatic cleaners. You use the rubber dam mask and all the safety equipment that you would use to remove mercury fillings.
Okay.
So those are smart certified dentists. And then you can be you pay more money to get to the next levels, and you have to do research. Most of the masters were the original 13 people that started the organization. But anyway, that's the easiest website to find somebody.
Yeah, and we'll link everything to the people watching this video and the viewers and give them access to it.
Yeah.
How does oral health impact the rest of the body? Things like inflammation, chronic diseases, things like that.
2 things about oral health is infections, essentially. So you've got acute infections, which would be a toothache, an abscess, draining pus, swollen face. You know, those kind of things. You are in pain, so you're going to run to the dentist, get that taken care of. Tooth extraction or drain it, get on some antibiotics. Now, the chronic inflammation, those are the things you don't really notice or maybe don't know about. So you may have a root canal that's failing, doesn't hurt a bit, but when you look at it on the x-ray, there's an abscess around it. You may have periodontal disease, gum disease, gingivitis. That's a chronic infection in the gum and bone around the teeth. And those things will get into your bloodstream. So they affect your heart. So they will promote blood clotting and heart disease, high blood pressure, hardening of the arteries. Chronic infection in your mouth actually affects the diabetes. And there are studies that show that it's associated with Alzheimer's disease. So those are the worst things. Chronic disease in the mouth, of course, your tonsils are supposed to catch it, but when they fail to, it makes you prone to upper respiratory diseases. like COVID and pneumonia. And then osteoporosis. There are a lot of studies that show that. So chronic disease in your mouth can affect your joints and arthritis. And like I say, osteoporosis. So your bones get weak. Talking about weak bones, too much fluoride also creates weak bones. Now you think about fluoride for hardening your teeth, and if you paint fluoride on your teeth, like you go to a dentist and he does a fluoride treatment, that's good for about 20 minutes, and then it's gone. So brushing your teeth with fluoride's the same problem. So we don't recommend fluoride. It will get, first it's a poison, it's rat poison, used all the way up through the 80s. I think you can still find it in a box as rat poison. But that's exactly what's in the toothpaste, that's sodium fluoride. And the fluoride will get into your pituitary gland, so it closes that up. And the pituitary gland's known as your third eye. So that, for astrology, that's a bad thing.
Sure, yeah.
Clog that up, calcify the pituitary gland, and that's the master gland which tells all the other glands in your body how to work. The obvious thing dentists notice about fluoride is especially when it's in the water, kids are swallowing the toothpaste, it will cause fluorosis, which when you look at somebody's teeth, they'll have these white streaks and brown streaks on their teeth. That's fluorosis. And those streaks actually have weakened the enamel on the teeth. It's not clear and pretty and translucent. It's also weaker and more cavity prone. Dr. Kennedy went to China because a lot of Chinese villages have shallow wells. And the fluoride, because the water runs through granite, was very high in the villages. So he went over there and documented the high fluoride in the Chinese villages. And the people walking through the villages had terrible arthritis, scoliosis, a bad back. They were crippled up, some of them so bedridden they couldn't even move around just because of the heavy fluoride in the water. And as bad as we don't like the Chinese government, the government was going out to those villages and drilling them 1,000 deep wells so that they could get fluoride-free water clean out of the ground. And the IQ of the people in those villages was very low.
Sure, yeah.
Very low. And for your own child that's brushing their teeth or getting fluoride treatments, fluoride will knock the IQ of your child down 10 points. So I would tell you stay away from fluoride. Try to get it out of the water in your house.
Yep.
Don't use it in the toothpaste. Don't get fluoride treatments at the dentist.
That was our next question. So he hit it. Do you have anything else you want to?
Well, fluoride, thyroid's the next big thing. So thyroid is all of your energy, your fat. It determines what's going on. And fluoride directly interferes with the uptake of iodine, which your thyroid needs. So living in Indiana or anywhere in the Midwest, this is the goiter zone. So you should be taking supplemental iodine. Lugol's or iodoral. If you read Dr. Brownstein's book or Dr. Levy's book, that's their favorite.
Okay.
But women need 25 milligrams a day and men need 12 and a half. And they figured that out from the Japanese, who virtually never get breast cancer. And iodine apparently helps prevent breast cancer if you look at it that way.
Yeah. So you are a no-no on fluoride. I see people on social media. You see things on Google that, it's not that bad. But you're saying...
Well,
Your opinion
Yeah,
is get rid of it, do not use it.
yeah, completely.
Yeah.
And I got plenty of patients that don't even want it in their sealants. Most dentists, when a dentist buys a sealant, the big thing on the sealant is releases fluoride. And I know the sealant in our office, we had to look for years before we finally found somebody that does not put fluoride in our sealants for kids. So
Yeah.
I would even stay away from that.
Yeah.
It's not a huge dose, but when it's not good, it's not good.
Yeah. One takeaway from this is people need to do their own research. They need to be informed.
Well, that was the last question you asked me, and that was my answer. You can look for an alternative dentist, and you can look for your alternative osteopath or MD or naturopath, but eventually you've got to look things up yourself and understand it, and then you appreciate what your alternative dentist or somebody's telling you, for one, and two, you won't get tricked into doing something that turns out to be bad.
Yeah.
And there's an awful lot of information on those 3 websites I gave you.
With me having stage 3 colorectal cancer, I came to Dr. Green, and he actually took out my 2 infected root canals. One was a back molar and then the very front tooth. And can you just kind of briefly, whether it's cancer, illnesses, what is the connection of the mouth and the rest of the body?
Well, I'd say there are 2 connections. One, the infection in your mouth from a dead tooth or an abscess will drain down through your body through your lymph nodes. So 95% of women that have breast cancer have a root canal or an infection on the same side of their face as the breast cancer showed up. And that's because the lymphatic drainage is down through their neck, through their breast, and then under their arm. So when you have breast cancer, the doctor loves to chop off your breast and go under your arm, pull all those lymph nodes out, because that's where they drain and they filter.
Yeah.
The other thing is energy, which acupuncture, of course, is what you normally think about with the energy running through your body and the chi. An osteopath that does manipulation to cure your disease is helping the energy flow through the fascia. That's how the osteopath works. That's how the acupuncturist works. And Dr. Tennant has a machine called the biomodulator. And the biomodulator puts energy into your body wherever it's short. So he's got several books. It's a Tennant biomodulator. It's sold by Synergy. It works like a rice machine for people that know what rice machines are. It puts frequencies into your body, so it raises the voltage. So Dr. Tennant's books are all about voltage. So the normal voltage in a cell is like minus 30, minus 50, something like that. When the cell is healing, it can go up to minus 70. When a cell has cancer, it would be plus 20 or 30. So the voltage changes. Now, voltage is analogous to pH. So people that are alkaline are going to be on the negative voltage, which is healthy. People that have acid body, acid saliva, acid urine, tend to be unhealthy and have chronic diseases. Dr. Tennant has a very interesting history. If you go to Dallas, Texas, take one of his classes in the summer, he will talk about how he found all of this out. Tennant happens to be one of the original researchers for LASIK surgery on your eye. So he was doing LASIK surgery on people, and like welding, there's a fume coming up from using a laser and frying tissue. And these fumes brought viruses into his eyes and into his brain. And he got to where he couldn't remember anything. He got the shakes. He couldn't control his muscle spasms. And he went to the Mayo Clinic. They told him, you've got 3 viruses in your brain. Go home and die. Well, he had periods of being clear, periods of tremors, and can't remember what he did 5 minutes ago. And during his clear periods, he studied homeopathy, auriculotherapy, acupuncture, Rife machines, frequencies, and he developed this whole machine and his whole treatment and his whole clinic. And he cured himself completely of that 3-4 viruses in his head. He's also able to cure people with macular degeneration, assuming you caught it soon enough and you're not already blind.
Yeah.
But the point is, he's done a lot of good work, and the sad thing is he's 90 now, so he's still around. The clinic's open, and it's a great place to go.
Yeah.
But that's where that machine came from, and he's the one that ties in that energy with the acupuncture license that I have and the classes I took for 5 years, which really helped me quite a bit with the biological dentistry, because I can now understand how energy running through your mouth actually affects the rest of your body.
Where's that clinic located?
He's in Dallas, Texas.
Okay.
Yeah.
So what are some other alternatives to root canals?
Well, since as a biological dentist, I don't like root canals, my alternatives are to extract those bad teeth, and you can replace them with an implant or a bridge or a partial denture. Now, there are some biological dentists, or maybe I shouldn't even call them biological dentists. I'm going to call them IAOMT dentists, because when you go to their website, they still vacillate between whether root canals are good or bad. They have researchers come and give, the last couple of meetings I went to, seminars on root canals, and they're trying to do them better and perfectly. The problem with root canals is you might have 3/4 of an inch that the dentist cleans out of your tooth with files, but there's 2.5 miles of microscopic canals in a root canal that don't get cleaned out. So the research on root canals to try to do them better is using lasers and ultrasonics and different solutions in order to try to clean out that 2.5 miles of canals. The bacteria colonize the pores in the root of that tooth, and they hide in those little microscopic pores. The white blood cells can't get to them. The tooth, the root, always becomes toxic. And Dr. Haley tested over 1,000 root canal teeth, and every one of them was extremely toxic. He said some of them even more so than nerve gas.
Oh, wow.
So to me, there is no such thing as a good root canal. I prefer to see you get them out.
Let's talk about mercury fillings. What's the history behind their use, and why are they considered harmful today?
Well, the mercury fillings they were invented in France, 1833, and they came over to the United States around, let's see, I wrote it down, around 1850. So the French and Germans were using it, so they imported that idea, technology to the United States. In the 1840s, there was the American Society of Dental Surgeons, and when amalgams came over here, they knew there was mercury in it. They refused to have any of their members use these amalgam type fillings. But they were so easy to put in, and they're so cheap to use compared to gold fillings or gold castings, inlays, which was the only other thing dentists had to put in teeth. The ADA, the American Dental Society, was formed in 1859, and that's the ADA that still survives today. So the American Society of Dental Surgeons has completely died out. The ADA took over and promotes amalgam fillings and still says they're safe today, even though there's clear evidence that the mercury escapes from that amalgam filling, accumulates in your body. Your body's not able to get rid of it as fast as it accumulates. So the mercury is a health problem in everybody that has mercury fillings. So out of curiosity, just to let you know, mercury's been banned in Germany since 1992. It's been banned in Sweden on pregnant women since 1998, and they're working on a complete ban. It's been banned in Norway entirely, Switzerland banned since 2020, and in Denmark banned since 2020. And Canada, right north of us, it's been banned in pregnant women since 1998. United States, we still say, it seems to be the standard of care and not bad enough to worry about.
So when I was diagnosed and we went down to the clinic in Mexico, that's when we first heard about a biological dentist, started down that. I had 3 mercury fillings that they removed down there. They didn't have a 3D cone beam scan. So they just took a regular x-ray and they said, well, it looks intact, it looks fine, but when you get back, find a biological dentist with a 3D cone beam scan. So I don't even know if we ever shared that with Dr. Green or Jennifer, that I had 3 mercury fillings removed early on. And then they said you might need to, remove the root canals. And that to me, because with the front tooth, I was like, let me think on that for a little bit. So
well, of course,
by the time I came here, it was like, let's get this thing out, because I knew, after the research we did and our homework, it was like, okay, all we need to do is find a biological dentist who will extract these. And then that's how we found you. What is the safe process, protocol, procedure on how to remove mercury fillings?
First thing I'd tell you is just look at the website, IAOMT or IABDM. They've got the procedure on the website that they recommend, and that's what we follow. So essentially, use a rubber dam to isolate the tooth that has a mercury filling. That will keep all the filings and vapor out of the patient's mouth, keeps the patient from swallowing the mercury dust in the old filling. Secondly, since you're drilling here and the nose is there, we have the patient breathe through a nasal mask, pure oxygen. That way there's no way my drilling goes in their nose and then into their body. And since mercury vapor, which is what's released in your mouth from chewing or drinking hot coffee or drilling out a filling, or even getting your teeth polished when your teeth are cleaned, that vapor is absorbed 96% in your lungs.
Wow.
So it's the worst exposure, worse than swallowing a chunk of filling, which would go in and then come out in a day. The other things we do is our elephant here is a great big giant vacuum that's laid on the patient's chest. So any vapor, any dust is sucked through that elephant into a giant filter, which is why the box here is so big. The patient itself is entirely covered with a sheet, a big bib that goes down to their knees, so they don't have any amalgam grit on their clothes when they walk home. The staff is wearing a mercury filter and a mask, and we're covered with a complete outfit, top to bottom, so that we don't take anything home. And besides that, The room itself has an electrostatic filter. So these emitters right up here and the collectors are over there. So that if there's any vapor in the air that somehow got missed by the vacuum, will always be collected on these collectors over here. So when you go into a regular dental office and they're doing mercury fillings in the back, you're sitting in the waiting room, you're still exposed to mercury. When you come into a holistic office that has some type of mercury cleaner in the back, well, then you're clean. You're safe.
Yeah.
It's healthy.
So is every dentist office removing mercury in that safe way?
No. The only thing the federal government and the state government has asked in some places and required in some places is to have a mercury filter at the other end of this water suction that you put in people's mouth. So in my basement is a big 5-gallon bucket with a mercury separating device in the bucket. So every dental office is, I don't think it's required in Indiana, but certainly the ADA in Indiana, because I know my friends are not mercury free, and they have amalgam separators in their place. But that's just to collect what goes through here, and that's the suction. And that's the only thing that a regular conventional dentist might be doing. So, and since you mentioned that, the only reason the government cares about that is because at their sanitation plants, when they're trying to clean the stuff up before they dump it in the river, they can't get the mercury out. And the dental offices are the highest source of mercury being dumped into all the sewage. Dr. Marcola calls the root canals dead teeth, gangrene left in your mouth, and dentistry is the only profession that leaves dead tissue in the body. So if you had a dead kidney, your physician would want to cut it out and throw it away. Because that always becomes a source of infection. And as I've explained, dead teeth always collect bacteria, whether they've had a perfect root canal or not, and they always become toxic. So there are 2 books. This is one of them. Implants, yes, I do like implants. I prefer zirconium implants over the more conventional titanium implants. Titanium's a metal, so it conducts electricity and it has a little magnetic pulse to it. But more importantly, you have a titanium implant, you got a gold crown over here, and you've got a porcelain crown over here that has a different type of metal underneath. You might have an amalgam filling or something over there. So you've got 3 or 4 different kinds of metal in your mouth. That creates an electrical flow in your mouth and in your body, and that affects all the electrical flows that I was talking about with the acupuncture points and things of that nature. So if you get an implant, you want a zirconium implant, which is white. It's perfectly safe. It's just as strong as titanium. And that implant has 0 reaction to your body. And more people are becoming sensitive to the titanium. Some dentists are starting to look around and try different materials. But titanium is safe, and that's why I think that's why I do recommend implants over other things. The bad thing is an implant costs a lot. It's the Cadillac of replacing a tooth. You do have to take care of it. You still got to brush it, floss it, water pick it. And if you don't take care of it, the implant will never rot, but it can go bad from gum disease. So with an implant, you don't get periodontitis because there's no periodontal ligaments. You get implantitis.
Is there,
Ah.
we want to respect your time. We thank you so much. I know there's a few other questions, but we've really hit a lot of these. We've hit
Yeah.
just through our conversation together. What would you share with the viewers?
Well, the general advice would be never get a silver filling. Don't let the dentist put fluoride on your teeth. Stay away from fluoride toothpaste. Don't get a root canal. Beyond that, what kind of toothpaste? Use anything without fluoride. I don't care. I tell people to brush with baking soda at night because, like I told you, being alkaline is healthy. Acid is what causes cavities in your mouth. Baking soda neutralizes the acid. So you'd brush with baking soda, use baking soda in the water pick. You go to bed with an alkaline mouth.
Yeah.
That will neutralize the acid, so that you should never get a cavity. If you're worried that you have something in your mouth dentally affecting your health, I would tell you do the obvious things first. Get rid of the mercury, get rid of the root canals, clean up your gums. Then beyond that, you can take a heavy metals test. That would check for whether you have a body burden of lead or mercury or arsenic or cadmium, uranium. There's a whole list on that heavy metals test. And it through doctors' data, they charge $125. And the test is collect your own urine for 24 hours, send it in. They send the report back to you. So beyond that, get on those websites, read about it, study it, learn for yourself. And that's the best thing I can tell you, because it is kind of hard to find a leader to guide you.
So if the viewers and everybody out there don't have any mercury fillings, root canals, any oral health issues, can they make the assumption that they're all right?
Well, that assumes that they never had mercury fillings, and if they never had teeth pulled or wisdom teeth pulled, because there's one other thing we haven't talked about, which is cavitations. And you don't, when you have a tooth pulled, you don't necessarily heal correctly every time. So some people will have wisdom teeth out and they have a dry socket, they have pain for a couple of weeks after the extraction. That area did not heal up right and is very likely to have a cavitation, which means there's some chronic infection in the bone. The bone doesn't heal properly, doesn't clean itself out. So if you've never had a tooth extracted, you've got all 32 teeth. The only other thing could be gum disease, tartar, calculus buildup around your teeth will cause gingivitis to start with and periodontal disease as you age. So you're not absolutely safe just because you never had metal in your mouth or had teeth extracted. I would still get your teeth cleaned 6 months, once a year, depending how fast tartar calculus builds up.
We talk to people, I would say on a weekly or monthly basis. They say, oh, I went to the dentist. I got a x-ray done. Everything looks great. Can you tell us the difference between a regular x-ray and the information that's on that and a 3D cone beam scan and what's on that?
Well, yeah. The big difference is with a 2D x-ray, you see my face, but you don't see this piece of paper in the back of my head. And on a 3D x-ray, you literally on the computer can turn the tooth entirely around so that you'll see that there's infection or hiding on the back side of the tooth. Because a regular 2D x-ray is just a shadow, and whatever's behind the shadow is completely hidden. Whatever's behind that tooth is completely hidden. So a 3D allows you to literally spin the tooth around so you can see everything.
Yeah.
I can find infections around root canals that you don't see on a 2D x-ray. You can find the cavitations on a 3D x-ray that won't show up on a 2D x-ray. So there is a difference. The unfortunate part is that x-ray machine, a regular one, is $5,000, and a 3D x-ray machine starts at $100,000. So that's why people don't buy them, don't have them. In a way, I can't blame them. But I got one because my kids are through college. The car's paid for, the house is paid for, the farm's paid for, the building's paid for.
Yeah.
So I could afford a toy. And I'm really pleased that I bought it. It's helped me find so much more. It really has.
Yeah, yeah, you're helping a lot of people. We appreciate you. We thank God regularly that we found you here in Frankfort, Indiana, and you played a role in my healing journey through cancer, and I'm appreciative of that. So thank you for your time, and maybe we can do this again sometime.